What happens during a sleep endoscopy procedure? Have you ever wondered what really goes on during a sleep endoscopy procedure? This specialized test, often referred to as drug-induced sleep endoscopy, is designed to evaluate the airway in individuals with sleep apnea. It plays a key role in understanding the severity of sleep apnea by identifying where and why airway blockages occur. The procedure takes place in a clinical setting where the patient lies on their back. An anesthesiologist administers sedation to create a sleep-like state. This is important because it allows the airway to behave as it would during natural sleep, making the findings more accurate. Once the patient is comfortably sedated, a flexible endoscope, which is a thin and lighted tube, is gently inserted through the nose. The doctor carefully navigates the scope through the nasal passages until it reaches the nasopharynx, which is the upper part of the throat located behind the nose. This step is crucial as it provides a clear view of the airway. From this position, the physician can observe the airway at various levels. They start by examining the velum, which is the soft palate, to check for any collapse. Next, they look at the oropharynx, the area of the throat, to see if there are any obstructions. Finally, the base of the tongue and the epiglottis are assessed for any potential blockages. During the procedure, the doctor monitors how the airway responds as the patient's breathing and muscle tone change under sedation. They also keep an eye on the patient's oxygen saturation levels. Sometimes, the doctor may perform maneuvers like jaw thrust or mouth closure to see if these actions improve the airway's openness. The endoscopy is not just about looking for obstructions. It also helps identify other issues like enlarged adenoids or masses that could contribute to sleep apnea. This detailed visualization during a sleep-like state provides information that cannot be gathered through awake examinations or standard sleep studies. The findings from a sleep endoscopy are particularly useful when combined with the apnea-hypopnea index, which measures the severity of sleep apnea. By pinpointing the exact locations of airway obstruction, doctors can tailor treatment plans more effectively. This might include surgical options or other therapeutic interventions aimed at improving the patient's breathing during sleep. In summary, a sleep endoscopy procedure involves sedation to mimic natural sleep, the insertion of a flexible scope through the nose, and a thorough examination of the airway at multiple levels. The results help customize treatment for sleep apnea based on the dynamic behavior of the airway observed during the procedure.